Okay, so welcome everyone. My name is Hillary Kane, and I am the director of FEND. FEND, for those of you who don't know, is the Philadelphia Higher Education Network for Neighborhood Development. We are a network of colleges and universities in and around Philadelphia, housed at Penn. But I always joke pretending to be an independent nonprofit because Temple, LaSalle, Villanova, Rutgers Camden, Bryn Mawr, Community College of Philadelphia, you name it, pretty much all the campuses in the region are partners and members. And so we support all kinds of community engagement, whether it's student driven, faculty driven. We're also just very deeply connected to the school district of Philadelphia, to the city of Philadelphia, particularly CEO, Community Empowerment Opportunity. And while we have not done a lot of hunger related specific programming in the last few years, we did way back in the day, like 25 years ago, work on SNAP enrollment with what the then coalition for why am I blanking on the name of the anti-hunger coalition? Somebody help me.
The Food Policy Advisory Council?
No, the
Oh,
Tanya Sen.
Coalition Against Hunger?
Yes, the Coalition Against Hunger. Duh. Sorry, you just have these like moments where everything falls out of your head. Anyway, the Coalition for Against Hunger had a SNAP enrollment grant from USDA. This is like 2000 to 2003. And we partnered with them and had students and faculty from multiple different campuses all working to help people figure out their eligibility and to then get enrolled. And so ever since that time, I've known more than I needed to or cared to about SNAP and how complicated it can be. And unfortunately, it has gotten even more complicated. And so in chit chatting with Tara at the city's CEO office, we realized like this is just information that the community needs to know, whether our higher ed partners who work in community, other folks, who are directly in the FED universe. And so, it's pretty easy for us to just open a Zoom room and let folks spread, share information. And so that's what we're going to do here today. So we will be joined by colleagues from Community Empowerment and Opportunity, which is the city's anti-poverty community action agency, as well as other experts from the Office of Children and Families, Office of Homeless Services, and Benephilly in particular. So with that, I'm going to turn it over to Tara, and you guys take it away.
Thank you so much. I'm Tara Williams. I work at CEO and I'm the Director of Workforce Strategies. And I've been lucky to be part of a team at the city who's doing our best to stay on top of changes at the federal and state levels, and making sure we're getting information out to people. It's just really important. The more people who understand the rules and can be part of the solution, the more people will keep their benefits. So just really appreciate everyone who's taking time today. And just a reminder that these are the SNAP work requirements for food access, but we're also even starting to think about Medicaid work requirements that will be affecting people in January of 2027. So we'll have more information on that in the future, but both really important benefits that are being impacted by these rule changes. So thanks for inviting us. We're really glad to be here, and I'm going to pass it to Ray on our team to go over some of the main rule challenges, and then we'll go through. We've got several other partners. And Taylor, I'm so sorry. Anything else you want to add to before we get started?
Sorry
Taylor,
about that, folks. Yep. Thank you, Tara. Thank you, Hillary. My name's Taylor Samuels. I am the benefits data specialist over at DBHIDS. I just want to make the name make sense. The art of reporting, it started as a conversation between me and my manager. Being the benefit specialist, folks also need to know how to report their earnings to social service offices. So it could be Social Security, the county assistance office. It could be your subsidized housing program. So it just started as a way to share best practice of how to do that. So you do not run the risk of an overpayment. And since then, it's kind of morphed into this short form programming about SNAP, since it goes hand in hand with reporting. So like Tara said, in the future we'll be doing, this, but Medicaid edition. So again, thank you for having us, and I'll pass it to Ray.
Thank you so much, Taylor, Tara, Hillary. Appreciate everyone having me here. My name's Ray Brunke. I'm the Policy and Programs intern here at CEO. And let's go ahead and get started. So as we discussed, we're going to be talking about some of the changes to SNAP eligibility. So I'll give you guys a quick introduction with some context about these changes. We'll talk about the actual changes to the eligibility, some next steps that our impacted recipients can take, and some resources. And then at the end, there'll be room for discussion and questions. So if you have any questions, feel free to pop them in the chat and we will take a look at them afterwards. All right, so changes to SNAP eligibility. So many adults must now meet work and reporting requirements to keep their SNAP benefits. These changes began September 1st of 2025 and expanded on November 1st. We'll talk more about the difference between those two dates. These changes are new to Philadelphians who have never had to meet these work requirements to receive their food assistance. And if impacted recipients do not meet the requirements, they can only receive SNAP for 3 months in a set 3-year period. So again, really important to make sure that we're helping people maintain these benefits. In other parts of PA where work requirements have been reinstated, about 64% of people lost their SNAP. You can see we just have some estimations of how many people this is going to impact. This is going to be a huge deal, so we want to make sure we're getting that information out there. So these changes to SNAP. These changes to SNAP eligibility are a result of the Federal Reconciliation Bill, the One Big Beautiful Bill Act. This bill removed geographic waivers that had previously protected Philadelphians. It also eliminates some federal exemptions for unhoused people, veterans, and former foster youth, although Pennsylvania does still have some discretionary exemptions, which we'll talk more about. This bill also removed many immigrant groups from SNAP eligibility as well. So lots of rule changes. Okay, so let's get into the actual changes. So starting on September 1st, 2025, anyone who is between 18 and 54 who does not have a dependent child under 18 and does not meet an exemption must start meeting SNAP work requirements. So this includes working, volunteering, or participating in an approved education and training program for a certain number of hours per week. It's typically about 20 hours per week or 80 hours per month, but it's different depending on what kind of activity you're doing. Then beginning on November 1st, the eligibility changed to include those up to 18 to 64 with no dependents under 14. So again, expanding that pool a little bit more. Okay, next slide. So we're thinking about impacted SNAP recipients in 3 different categories. So there are those folks who are exempt. So these are people who are meeting listed exemptions, which we'll talk more about later, and have reported that to the CAO so they can continue receiving their SNAP. We have those folks that are complying, so they are impacted, but they are meeting the work and reporting requirements. And then we have our folks who are time limited. So this is folks who receive SNAP for 3 months only if they're not meeting exemption and not meeting a work requirement. So the first loss of SNAP benefits has already began for people, so it's really important that we make sure people are taking action now to be prepared. So Pennsylvania Department of Human Services and CEO is really making an effort to focus on exemptions as a way to help people maintain their benefits. As you can see, there's a huge list of exemptions. Just a couple examples: anyone making over $217.50 per week, folks receiving disability benefits, and folks with a physical and mental medical exemption. So if you do qualify for one of these exemptions, you want to make sure that it's known to the county assistance office. Some may already be known, things like age or status of your disability benefits, but other exemptions need to be reported. There's some forms, and I'll go over those. And that's how those exemptions are reported to the county assistance office. And something important to know is that exemptions are only applied per person. They're not for the entire household. So if you have several adults in your house who are not exempt, they each need to be doing this paperwork. So this is a great tool by PADHS, an exemption screening tool. So this is a great tool to provide to clients to for them to assess if they could be eligible for an exemption. As we saw, it's quite a large list. So the screener is a really great way to figure out what exemptions folks might be qualified for. So here is the CM 558. This is the PADHS exemption survey. So this is the form that needs to be filled out to identify exemptions to PADHS. Something important to note is that the screener is not the same as the form. So filling out the screener is just for your own personal information. The form is what actually gets submitted to the county assistant's office. This form can be found on the PADHS website and can be filled out by any SNAP recipient or a supporting entity. I see a question in the chat about medical exemptions. We're going to talk about that a little more now. So the medical exemptions are reported using this 1921 form. This form can be completed by any provider with a relationship to the affected recipient. So doctors, nurses, PAs, social workers, pretty flexible on who can fill out this form. Again, this can be found on the PADHS website.
Right. Can you talk a little bit more about like what qualifies as a medical exemption, all that good stuff?
I'm not sure what they're actually qualifying as a medical exemption on the form. I would need to take another look at it.
Gotcha. And I can hop in here. From what I understand, there's a very, like Ray said, very broad range. As far as I know, the county assistant's office hasn't been asking for any kind of supportive documents, no, medical records or anything like that, to ensure that, it's verified. And it could be something as it's defined as something that reduces your ability to work. So it could be something like, major depressive disorder or anxiety or anything like that. Thanks, Ray. Sorry about that.
Thank you, Taylor. I appreciate it. Okay, so next steps for Impact to SNAP recipients. So if folks are not meeting exemptions, there's a couple different paths that they can take in order to maintain their benefits. So the first would be working at least 80 hours a month. With this work, there's no pay requirements, so the pay could be in kind in exchange for housing, and weekly hours can fluctuate without reporting as long as those monthly requirements are met. The second method for complying would be to participate in an approved employment and training program. So, for example, something like SNAP Keys or SNAP Earn. The county assistant's office can help refer people to education and training programs. There may be other specific requirements associated with that, like completing an education development plan. But that can all be specified by the county assistant's office. And then the third method for complying with SNAP activities is community service and volunteering. So the number of required monthly hours is determined by dividing your SNAP grant by minimum wage. It's typically around that 80 hours a month, but a little bit different depending on what your benefit looks like. You can volunteer with nonprofits, religious organizations, and public entities. Anyone who's able to fill out this 1938 community service form. And something great to note is that volunteer hours can be done by any member of the household subject to the time limit. Participants also may need to complete an employment development plan and be assigned to a program to monitor hours. This is something that we're leaving to the CIO's discretion at this time. There's also some changes to SNAP eligibility for certain immigrant communities under this new federal law. So folks that are U.S. citizens, folks that are Cuban or Haitian entrants, or folks that are from COFA nations, those people will all be immediately eligible for SNAP. As well as green card holders in the following categories. So those who had refugee, asylee, or T visa status before getting their green cards, children under 18, and anyone receiving medical assistance for a disability. And all other green cards have to wait at least 5 years before they can receive SNAP benefits. So this is, again, quite different from how it used to be. Something important we want to know is if you have a green card, you want to make sure the county assistance office knows about it so that you can continue receiving your SNAP benefits. Okay, in review. So there's a couple next steps that we're hoping that people can take in order to maintain their benefits. The first would be reviewing the PADHS website, so completing that screening tool and seeing if any of those changes apply to you. Making sure your address is up to date with both PADHS and the U.S. Postal Service, and checking your mail and Compass portal regularly for notices about these changes. Making sure, if relevant, you complete the exemption survey and the medical forms and submit them either on Compass or in person. And if you're submitting in person, it's always a great practice to make sure you're getting a receipt for that submission. If you're not exempt, you want to identify work activities with the county assistance office and participate as required, as well as reporting your status and activities to the county assistance office. And for folks who need additional resources, we'll talk more about the free food and meal finder later. There's also a PA platform called PA Navigate, which can help folks connect to different resources in a bunch of different categories. So we do have some additional help available. So SNAP recipients can get assistance with navigating these benefits changes through their county assistance office or the county assistance office customer service number. We're also going to talk more about the Benefitly Clarifying hotline later, but this is another service provided by CEO that can help people navigate these benefits changes. And for those folks whose application is denied or benefits are reduced, Community Legal Services is providing assistance with appeals for those folks. I know this was a lot, so this is kind of a summary of all the different information presented. So general information about work requirements can be found on the PADHS website, Community Legal Services, and City of Philadelphia also has a landing page that's updated regularly. So you can see the important forms we talked about here, as well as a couple of resources. So again, the Food and Meal Finder, PA Navigate, CEO Philly has a resource guide, and again, we'll talk more about the Benefitly program later. That's another great source of help. We do have some flyers available for folks if you want to distribute these to your communities. All of this information explained quite clearly and simply. Because there are Medicaid changes and work requirements to follow, we want to make sure we're building a connection and informing people as soon as possible. And like I said, this is the City of Philadelphia's SNAP information page. So we're regularly updating this with all the new information we receive from PADHS. So this is a great resource to go and get a quick summary of everything we've talked about today in this presentation. Thank you so much, everyone. I'm going to take a look at the questions. I might not know the answer to all of them. Okay, yes, full-time students in high school, trade school, or college, that is an exemption category. So these are folks who would want to fill out that CM 558 form to show that they are enrolled. You have to be enrolled at least half-time in some kind of education program to qualify for the exemption. And then I don't know the answer to this question about foster parents. I'm not sure if anyone has the answer to that.
Donna, would you happen to know the answer to that question?
I'm actually looking in the chat. Do foster parents of children under 14 qualify for exemption, even if the children are not dependent? I can get I'll have to get some more clarity on that, but if the foster parent is already receiving benefits for that child under their case, they should be eligible. But I will get some clarity on that and report back so that we can get that actual answer.
Thank you. And I think we would just say do the screener and get in touch with your county assistance office just to make sure they have any information to make sure that you would be exempt or that you know if you need to comply with the requirements.
And yeah, we will be distributing the presentation slides afterwards, so everybody will have all these links handy for you.
All right. Thank you so much, Ray. There were a ton of resources. I had a little resource page at the end, just on my end, and you covered all of them. So everyone, please use the resource page and CEO's presentation. It's a lot more resources there. So next we have Donna from Benefitly to talk about Benefitly services and their locations.
Good afternoon, everyone. My name is Donna Clement Jackson. I am the Benefits Access Project Manager for the Benefitly program, and thank you for having me today. Next slide, please. So, Benephilly is a part of the Office of Community Empowerment and Opportunity, and we are the city's only and community action agency in the city of Philadelphia. On this slide, for the sake of time, I'm not going to read. Well, I will read this. Our mission is to provide leadership on issues of economic justice by advancing racial equity and inclusive growth to ensure that all Philadelphians might share in our prosperous future. Next slide, please. So what we have done in the Benephilly program is we started looking at some of our client base and the people we served, and we started noticing that there were a lot of similarities in the barriers that residents were facing when they tried to receive public benefits. This list that we have here is some of the top ones that we found was consistent over the throughout the city. And you'll notice a lot of them are talking about.
Do we lose Taylor and the speaker?
I think I think Donna did freeze. I don't know why my name is over Donna, but that
I mean, I guess
I don't know how that
your
happened.
your link.
Possibly.
That's fine. I
That'll
mean,
do
you
it.
can change her name, but it looks like we lost her. It's like she's there, but she's not there. I don't know. Maybe her internet. Um, is it possible for you to pick up where she left off?
Yes, I can do the next slide, I think.
I just maybe one quick thing before we get back into the slide. I'm looking in the chat and about the AmeriCorps piece. And so I think there's distinctions here. So regular AmeriCorps is treated one way in terms of benefits, AmeriCorps State National, I should say, versus Vista. And it seemed like Vista was an exemption for the work requirement eligibility. I think what Matthew was asking was, does AmeriCorps count as work? So not the exemption, but just like if I'm full-time in an AmeriCorps state and national program, not Vista, does that count as meeting the work? And I don't see why it wouldn't, because you'd be making more than $217 a week. But I think I just wanted to clarify what I think that question was getting at.
Thank you, Hillary. That is what I meant. I also though want to say that often, I mean, every AmeriCorps program I've ever encountered, they put zero as the income. So I don't know if that's going to become an issue, because it's a
Oh, that's
stipend. It's not
interesting.
income. It's not technically income. It's a stipend. So it's
I'm not so sure about that, actually. I mean,
yeah.
regular, I don't know that that's well, we can get into that. Like, yeah, we'll have a separate conversation about
I'll
that.
say nothing.
But yeah, so I don't know if Donna's back on, but
I had to jump on Tara's computer. I
no
do
worries.
apologize.
That's all right. Great.
My system has been knocking me in and out, so I did miss those last questions. So I'm not sure we went over the barriers. Could we go to the next slide, or did anyone have any questions regarding some of the barriers that I just mentioned? Okay, if we could go to the next slide. So here, what we did at Benephilly was we created what we call a Benephilly benefit suite. On this slide, you will see all of the benefits that we can assist residents with applying for. You'll notice we have a category under healthcare prescriptions, so we can help residents fill out CHIP applications, Medicaid, PaceNet, shelter and utilities. We actually can assist them with all of the utility applications, some of the state applications, such as the property tax rent rebate, the senior property tax freeze is through the city, as well as LIHEAP and crisis, which are also through the state. We also assist with SNAP. In the far corner at the bottom, you'll see some screening and referrals. Although we don't have direct access to apply for these applications on behalf of the clients, we actually can assist with doing soft referrals. The good thing with our benefits Philly specialists is even when we do the referrals, we do follow up with the clients to make sure that they are getting a response and they're just not held in limbo once we transfer them. Next slide, please. So we looked at our impact from 2024, and across the board, we actually completed about 5,950 applications on behalf of residents. If you notice, the 2025 number only shows from January to October. So our reach was, oh, I could take this off, I'm sorry. Our reach was actually larger than the number that showed, and we exceeded our expectation in that number. And I apologize because I did not update this slide to be able to provide that number. Next slide, please. So what Benephilly does is we offer one-on-one support to Philadelphians in enrolling in them benefits. The way we do that, we have a few ways that you can contact Benephilly. You can reach us through our Benephilly Clarify helpline, which the number is here. And if a resident called the helpline, they will be transferred to one of our Benephilly specialists who would work one-on-one with the individual. You can also reach out to our CEO Benefits Access mobile unit, as well as one of our 5 community-based Benephilly centers, which I'll talk about on our next slide. Next slide, please. So right now, Benephilly has 5 centers where you can actually walk in, clients can walk in person and receive the one-on-one assistance. We have Catholic Charities, Philadelphia Fight, and I again apologize because USEF, as of January 1, is no longer one of our partners. So I need to definitely, we have to update that slide. But Philadelphia Fight also sees residents, but they will only see residents who are already enrolled in their medical center because they deal with primarily the population that's dealing with HIV and other issues, other medical issues of that such. And we also have Impact Services, which has 2 locations. Next slide, please. So the Office of Benefits Mobile Access Unit is the department where we actually work in. And what we do is we man that Benephilly hotline. When Clarify sends someone to they call in a hotline, they will reach one of our benefits access specialists who will do the hands-on. The other thing that the mobile unit does is we do presentations to different organizations like yours, explaining the benefits and things that are changing, not just what Benephilly offers, but we did a lot with explaining some of the SNAP changes and everything that was going on. So we actually go to different organizations, and some of our specialists are housed in different locations like the School District of Philadelphia, Congresso. So once a week, we may go to those sites to help clients personally. Next slide, please. So I know I said a lot, so I just want to give my contact information. Again, my name is Donna Clement Jackson, and I'm also providing you with our director's name in case you needed some additional information or resources or would like to schedule us to come and speak to any of your organizations. And that is Ms. Ursula Ortiz. Next slide. Okay, so I think that covers my presentation. Is there any questions or anything that I could assist with? I'm trying to check the chat. Okay, I don't see anything in the chat that directly pertains to Benephilly. So I just want to thank you guys for having us as always, and we're here to help. Thank you.
Thank you so much, Donna. And does anyone have, this is a really good question. Does anyone have an answer to this education and training question?
Education and training. Okay.
And if not, I will look into this and follow up with you.
Yeah, I would have to get clarity on that also.
I appreciate it. We are also, just confused across even at the state level in some of these places. So thanks for us continued working together to push for clarity. I know this is not hyper-focused on post-secondary students, Hillary, but overall, of course, the intersections for our community, appreciate it. Thanks, guys.
Yeah, we're trying to cover all the bases today. And
And
then
I
are you
think
seeing this other question about halftime, how that gets defined?
The only thing I can add, and again, the rules are so complicated and things are on a case by case basis. So I want to just give that caveat. We do know that if people are subject to the rules and they need to meet the 20 hours, there are times where people can do a combination of activities. So that might be like if they only have work for 15 hours a week, they still need to meet that 5 hours. So that might be done through community service or in-kind work, unpaid work. So there are situations where you might still need to get up to the 20 hours and you could do a combination of things. I don't know in this specific case if like there's special consideration for, somebody that's working on their high school diploma, but just wanted to share the opportunity to blend activities.
Thank you for that, Tara. Oh, new one. Awesome. So I have taken note, Ali and DL, about these questions. I'll look at them a little bit more and get back to you both. Or this one, yep, it just needs to be 80 hours per month. If you work a little bit more one week, a little bit less the next week, as long as it comes out to 80, you're all good to go. If for whatever reason someone's not able to work, for example, they're ill or they lose their job, if they have a good reason, I can't quite remember the term, there is an exception in place for that. It just has to be all documented. So next we have Laura Crandall to talk about free food sites in Philly.
Hi, good afternoon, everyone. My name is Laura Crandall. I am the Director of Food Security Initiatives with the city's Office of Children and Families. Go to the next slide. So our work is for our food security initiatives work, we define food security as all people at all times having physical and economic access to both safe and nutritious food that meets both their dietary needs and food preferences for an active and healthy life. I like this definition because it talks both about what's going to meet people's dietary needs, but also like what their preferences are for the foods that they want to eat for a healthy life. Our work is really about connecting all Philadelphians, especially children and families, to free food resources and meals, but also to programs and benefits that are going to support their long-term economic security. Go to the next slide. I just wanted to share some data, some statistics about Philadelphia. I imagine that these are numbers you may already be familiar with. Here in Philadelphia, food insecurity has been a problem for a really long time in our city. And unfortunately, it is an issue that has been increasing over the last several years. So 1 in 6 people, and that includes 1 in 3 children, are experiencing food insecurity in Philadelphia. That's over 277,000 Philadelphians. And that in the most recent data we have is from 2023. And so that number has increased since 2021. That means over 100,000 children in Philadelphia are experiencing food insecurity. And of course, this doesn't impact everyone equally. People of color are 2.5 times more likely to be impacted. Go to the next slide. Some ways that food insecurity affects people, especially thinking about our children, our young people. So it can increase instances of trauma, anxiety, and depression. Youth may be more likely to miss school or to experience social behavioral problems at school because they don't have the energy to deal with situations that feel stressful. We know that adults and caregivers and parents are often trying to protect their kids, so they may be skipping meals or eating less to make sure their kids can eat. And there's a lot of stigma around this, so the data that we have may not actually reflect how big the issue is because it's often underreported by families. You can go to the next slide. So I want to share some resources we have here at the city. So we have this free food and meals finder, and I'm going to put the link in the chat so you can check it out. So this is a list of food pantries, free meal sites, benefits assistance sites, older adult meal sites, and in the summer we include all of the summer meal sites for kids here on the map. We work with partners including Philabundance, Share Food Program, the Office of Homeless Services, Philadelphia Corporation for the Aging, and many others, Benny Philly, to keep the map up to date. It's searchable by address and zip code. There's also a filter option, so you can search by day of the week and time of day the sites are open, and it's available in 6 different languages, so English, Spanish, Chinese, Vietnamese, Russian, and French. You can go to the next slide. If you scroll all the way to the bottom of the site, there's a section that says more resources. So you can click on getting free food and additional support, and it'll take you to this other resources page where you can see the Office of Homeless Services list of their free meal flyers. It connects you to Community Resource Connects, which is the same as PA Navigate or Find Help or Aunt Bertha. It also connects you to probably not a lot at this time of year, but starting in the spring, the list of farmers market locations where you could use SNAP benefits or farmers market nutrition program vouchers through WIC or the senior farmers market nutrition program vouchers. And it again connects you to more resources to help apply for additional benefits. You can go to the next slide. We have some outreach materials available, and I'm actually going to put a link in the chat to our free food and meals flyer, which we have available in more than 15 languages. So feel free to, download, print copies of that for your communities, share it widely. There's a QR code that links directly to phila.gov/food. The other link on the slide is for postcards, which we have available in 8 languages. I have an example that I always keep at my desk, where we have English on one side and Spanish on the other in this example, but we have those in multiple languages. If it would be helpful to have paper versions, printed versions of some of these resources, my email will be at the end of the presentation. Please feel free to reach out to me. If we have the budget, we certainly can do our best to get you some printed copies of these materials. Go to the next slide. And then if you go on the site, so we are doing our best all the time to work with our partners, to work with sites directly to make sure that the site is as up to date as possible. For example, during the SNAP lapse in November, we partnered with the city's 311. They called through every single site on the map to make sure that we had the accurate information, the accurate address, the accurate hours. But if you see something that is out of date, then please get in touch with myself and my colleague, John Fitzgibbons. Or if you know of a site that we should add, then you can get in touch with us. You can share this information, but now we actually put together a form, so I can send you a form to fill out and we can get that information updated on the site. Next slide. That is all from me. I'm happy to answer any questions anyone has.
Awesome. Thank you so much, Laura. Really appreciate that. Next, we have Claire from OHS, Office of Homeless Services. Sorry, a lot of letters in the city, a lot of acronyms, to talk about food services in Philadelphia.
Hi, y'all. So like Taylor mentioned, my name is Claire. I work in the Office of Homeless Services, specifically in the Food Services Unit. So I'm going to tell you a little bit about OHS's programs, the different buckets that our work falls into, and then some great resources to share with the community. So the goal of OHS is to make homelessness rare, brief, and non-recurring. And our work falls into 4 big buckets. The first is prevention and diversion. So if we can help you stay in your home, avoid losing your shelter, that's what we're going to do. So we have rental assistance programs. We also run the Stranded Travelers program. So basically, if you're here in Philly and you're experiencing housing insecurity, but you have a place that you can stay anywhere in the continental US. Say you have family in Jersey, we can get you on a bus to Jersey as long as you can prove that like you have somewhere to go. Second bucket is the emergency and temporary shelter. So this bucket of work basically pertains to what people typically think of when they think of housing shelters. If somebody needs a place to stay for a night, they come to one of our intake centers and we place them at one of our sites across the city. We also have long-term housing programs. So it's basically what it sounds like. People will be in the program that they're assigned for a longer period of time. And typically this comes with a lot of supportive services. So if folks are interested in accessing those first three buckets, so our housing programs, the best way to do that is by going to one of our intake centers. We have two main ones in the city. The first is Apple Tree Family Center. That is located at 1430 Cherry Street. And then we have the Roosevelt Darby Center, which is located at 804 North Broad. These intake centers are open from 7 a.m. to 5 p.m. Monday through Friday. We also have a couple of after-hour intake centers, which the details are available on our website. The fourth bucket of OHS's work is where I work. It's the food services unit. So basically, we try to make sure that folks have access to food around the city that's both nutritious, it's what they like, and it's culturally responsive. So now we'll talk a little bit more about my unit's work. So here I've laid out a couple of the goals of my unit. First one is that we want to make sure that people are getting this food in a safe and dignified setting, the same way that you or I would want to be treated. So while it's great for you to just provide free food, we want to offer tips and tricks on how we can make that feel a bit more dignified, whether that be making sure that there's a place for people to sit while they're eating, making sure that they have cutlery, making sure that we're cleaning up after the meal service. There's a lot of little things that folks can do to just make that meal feel a little bit more special. We also are constantly working to make sure that the food that we're serving is nutritious. So actually at 7 of our sites across the city that participate in the CACFP program, which I'll speak about in a few minutes, we've recently launched a taste testing program with the goal basically to expose folks to different types of food, different ways to prepare it. So at these shelters, we've prepared carrots in 7 different ways each week. And that way they can try which ways they like, which ways they don't, and just get a better feel for it. In addition, sorry, back to, it's okay. In addition, we really see these meals as a way to connect people to other resources. So a lot of our meal sites will have social workers on site. They might be able to help connect people to our intake centers and housing services. So we want to make sure that we're helping our meal providers be able to connect folks that come for meals to a bunch of different resources. And then finally, we work to support capacity building for our partners. We host a ton of trainings and offer a lot of different resources to make sure that they can best serve the folks that come to them for meals. Perfect. So now I'll talk about a couple of the programs that we help to administer. So the first one is the Child and Adult Care Food Program. That's one that I was just talking about with the taste testing program. It operates in 7 different shelters across the city and provides reimbursement for meals that are given at those shelters. Philly is unique in that we're one of the few places in the country that operates this program in emergency shelters. And so actually a couple of my colleagues get to go to a conference every year where we talk about that work and try to help people in other cities across the US think about how they could do this in emergency shelters. We also administer the State Food Purchase Program. And so this program provides cash grants to counties like Philly that allows us to procure different food for our warehouse. The food that we get from the State Food Purchase Program is then distributed to different shelters and soup kitchens across the city free of cost, and we buy in bulk so that they're able to feed a ton of different people. The third program that I want to talk about is the Emergency Food and Shelter Program, EFSP. So this grant is available to different organizations to help cover the cost of rent, mortgage, utilities, shelter, transportation, and food. Like I said, this is open to organizations of all types. So if you or your organization or an organization that you know of, if you think that this could be applicable, the best way to figure out when the grant application opens is to sign up for our newsletter, which I will talk about on the next slide. We also administer the Emergency Food Assistance Program. That's called TFAP for short. Basically, we get food that is distributed to fill abundance and share, and then they provide food to smaller shelters, soup kitchens, churches, etc. across the city. For each pound of food that they distribute, the state then also reimburse them. So it's a great program because not only do we get free food, but we're also able to provide reimbursement for quick distribution. And then finally, we run the OHS warehouse. This is located in North Philly, and this is where different shelters, soup kitchens, and any group that might be serving free meals can come and get free food. So we primarily procure products through the state food purchase program for our warehouse. Next slide, please, Taylor. Now I'll talk a little bit about some of the resources that the Food Services Unit offers. The first one is the free meals flyer. So Laura alluded to that in her presentation, and I have a picture of it on the next slide. But basically, it is a printable version of free meals that are available throughout the city. It lists date, time, location, and phone number. Any meal that's listed on the flyer is completely free, no appointment necessary. Folks can just show up and get a free hot meal. Like with Laura's resources, this is available in multiple different languages, and the most up-to-date version is always available on our website. Next, we have linked the online free food locator. So that's what Laura talked about. This is a searchable tool. You can put in an address, zip code, and it will pull up a bunch of free meal sites. It's a little bit more all-inclusive than the free meals flyer. As Laura was saying, it includes both hot meals, but also groceries, meals for students. It includes just a bunch of different things. So great place to send people if they're hungry and looking for a meal. Next, we have the Resource Row newsletter. So this is the bi-monthly OHS newsletter that has updates both from my unit, but then from the other 3 units in OHS. This is a great place to find out about trainings, about different grant opportunities, and just a good way to stay connected with the agency's work. Next, I have the Regional Foundation Center linked here. So that is actually a program through the Free Library, and they offer a ton of grant writing workshops. They offer different sample documents if you're interested in starting a nonprofit, and all of these resources are free and available on their website. This is a great place to send people who might be interested in increasing the amount of food that they're serving, but they just don't have the funds. A lot of the groups that we work with are just churches, mom and pop organizations who are looking to expand but don't necessarily have the resources. So we always direct them to the Regional Foundation Center to get a little bit more of a deep dive on how they can expand their services. Next, we have the tools and resources page. So this is on the OHS website. This is a great place to go if you're serving free food yourself, and it lists out a ton of different resources to help make sure that you're providing food in a safe and dignified manner, making sure you're following all city protocol, and helps you get connected to other OHS resources. So it's a great one-stop shop to check out. And then finally, we host trainings. So we try to host them every few months. And really the goal is to cover a bunch of different topics because we know that our meal providers are seeing people who come in with all different needs. And so we want to make sure that we give them the tools to have as many resources as possible. So we've hosted CPR trainings, we've hosted mental health first aid trainings, we've hosted an info session on drug trends in Philly. We really tried to provide a comprehensive overview so our meal providers have all the information that they need. On this slide, we have photos of the free meals flyer. So as you can see, it's listed out by day and then mealtime. And like I said, all meals are free. No appointment necessary. Folks can just show up and get a hot meal. And the most up-to-date version is available on our website. Here are photos of a couple more of our resources. On the left-hand side is the outdoor public serving of food safety permit. If you're going to serve meals outside, whether that be in Love Park, whether that be in Kensington, anywhere in the city, you're going to need to be sure to get this permit. It's available on I think it's the Environmental Health Department's website. We actually don't administer it. We're just kind of in charge of advertising it. And then in order to get this permit, you also are going to need to take a food safety course. On the right-hand side, we have a flyer that helps you kind of think through who's the best person to call if you see somebody who you think might need help with housing assistance. We have a ton of different phone numbers listed. We also have information about our intake centers, so this is a great comprehensive resource. And then finally, we'll wrap up with just a couple ways that you can help. So I'd encourage everybody to save our outreach line's phone number into your personal phone. The number is 215-232-1984. So if you see somebody who you think might need help, you can call this number and we'll have our outreach staff come and see if they need help, see if we can offer, even just if it's like water and blanket. Our outreach workers are always trying to figure out ways that they can meet people where they are. Second, we'd encourage folks to volunteer with one of our partner organizations. So a great place to start if you're looking to volunteer is to take a look at that free meals flyer and contact one of the organizations and ask about volunteering opportunities. We often direct people to Broad Street Love and Hub of Hope in Center City. They have multiple volunteer opportunities a week, and they can they can offer volunteer opportunities to large groups. And then finally, we recommend giving items or money to organizations as opposed to individuals on the street, especially with monetary donations. Groups like Philabundance or other big organizations can typically just stretch money a little bit further because they're often buying in bulk. So we recommend donating to an organization as opposed to folks you might see on the street. Next slide. I have our emails at the bottom. So my email is claire.moss@phila.gov. And then I also have the food access email that is linked here. And I'm happy to answer any questions.
Claire, I do see one in the chat. John, did you mean the homeless outreach, the number Claire mentioned?
I think that might be the Regional Foundation Center is what he's talking about.
Gotcha. Just kidding. Never mind.
No, I kind of missed the one you were just saying about like they'll come out, give you water and stuff like that. So I was wondering, sometimes we have clients that aren't enrolled in our program that come up to us at our Temple outreach van. We're not out medication van, and sometimes we have people who are looking for shelter but don't always have a way to get down to the intake centers. So I was just wondering if we were to call that number, let them know we have a male or female who wants shelter, would they come out and do some type of assessment, or how does that work?
Yeah, so if you could put your email in the chat, I'll follow up via email as well. But I'm 95% sure that somebody has to have a certain number of like interactions with outreach staff before they can get placed like on the spot. So I will follow up with my colleagues who work more on the housing side of things. Full disclosure, I do food, so I don't know the exact number, but I believe that's how it works. I don't think that if you called like one time that they would be able to immediately transfer people, but I'll confirm and I'll get back to you via email.
Okay, so it's just based off of their what I get what you're saying, like based on their availability, like how many times they dealt with outreach.
Exactly. Yeah. So if the number's 3, if they've seen our outreach workers 3 times, then outreach is able to help put them in shelter, but it wouldn't be like the first time. But yeah, let me follow up with our housing folks to get the exact process, but I'm pretty sure that that's what happens.
Okay, cool. No problem.
Any? Oh yeah, I was just gonna say, any other questions?
Awesome.
All right. Well, this has been a lot of good information. I'm just really encouraged by the number of people on the call, the quality and detail of the questions, just the comprehensiveness of everything. So we will be sharing the slide deck. We'll be putting up the recording. If you're not already getting the weekly FEND newsletter, you will be. And that's where we'll be posting some of this stuff. And then, yeah, just reach out. Like if you don't know the answer to something, reach out to obviously the folks in the room who are the experts, but you can always reach out to us here at FEND and we will find those experts because we know someone who knows someone who knows someone. So that is all. And I think back to the AmeriCorps question, we tabled that and Matthew and I are going to have a separate sidebar within the AmeriCorps community. I do know there's also a lot of interest in the higher ed community on how this impacts students who are facing food insecurity. Amazingly, apparently we have someone from Virginia on the call, so this is an issue that is reaching far beyond our borders. But I want to thank everyone for taking the time. And we will probably do some follow-up because there's been so much interest on this. So thank you again. And thanks to all the presenters.
Thank you. Have a great day.
Bye, everyone.
Thank you.
Thanks so much.